Dear colleagues, dear friends, we have just overcome the extreme challenges posed by the COVID-19 pandemic. It has been a fierce battle, consuming a lot of energy and resources, but we showed ourselves that science and policy can come together to find solutions to a highly demanding task. It is based on that experience that we should now be able to face and win the next pandemic, which is not due to viral infection, but it has been slowly yet continuously spreading, particularly across the high-income countries. As you can easily guess, I'm referring to non-communicable diseases, with obesity and diabetes being the sad and dramatic champions among them. Obesity is more and more starting in childhood and adolescence to become real threatening to the future health of our children, as the condition can track into adulthood and increase the risk of diabetes, cardiovascular disease, and cancer. Conditions associated to obesity account for up to 7% of total healthcare expense in Europe. As we manage to come together and find a vaccine for SARS-CoV-2 in an unprecedented short time, we must now develop innovative and sustainable solutions to decrease the rate of obesity in childhood and limit the spreading of all other non-communicable diseases. Childhood obesity is a complex and multidimensional problem requiring structured and coordinated actions, which will require the involvement of the families and modification of the obesogenic environment. To this extent, we need making sure childhood obesity is placed and kept on the political agenda, aiming at governmental support to implement prevention and management programs in a sustainable and sustained fashion. The financial implications of these programs need to be factored in, yet full appreciation should be gained of the low cost of obesity prevention compared to the high financial burden of the treatment of obesity and its consequences. The process must rely on the engagement of industry and the private sector through concerted reformulation of food and beverage labeling and appropriate regulation of marketing and advertising, particularly those addressing our children, even if not particular through digital marketing. The society needs to take action. This would require considering the social determinants of health, including the impact of climate change and the structure of our metropolitan areas, which too often limits, for instance, physical activity of children, even around schools. We need considering improving the training of healthcare professionals on obesity prevention and management, who could approach children in a friendly manner. To this extent, technology can represent an opportunity. Gamification, for instance, may help engaging children, bring into their attention and consideration issues related to eating and behavior. And of course, we need supporting continuous research in the field. Research that may enhance our chances to be more and more impactful. For instance, precision medicine needs to be developed, allowing identification of groups with specific risk on which a more focused preventative intervention could be implemented. These are some items to be considered, but I'm sure that during this conference, many more ideas, better strategies, informative discussion will be generated. We do need coming together and take action for the very reason that what we are talking about are our own children, the future of our societies. It looks to me these are pretty good reasons to work hard to reduce, if not prevent, the burden of obesity and all other connected non-communicable conditions. For this reason, I wish all of you a very fruitful and productive work.